The guide wire allows the nephroscope to safely access the kidney. Some stones can be removed directly using a grasper. Larger stones need to be fragmented first, using a device like a laser before extraction. After removal of all the stones, your surgeon will perform a contrast study. When there is good passage of contrast material to the bladder, this means that the ureter is also stone-free. In some patients, a temporary small tube, called a double J stent, may be placed to ensure that swelling does not block the drainage of the urine. The stent remains in place by J-shaped curls in both the kidney and bladder.